Dr. Ankita Kadakia, and I'm the Deputy Public Health Officer for the County of San Diego. I'm also an infectious disease doctor. Let's talk about Mpox. Last summer, there were a lot of cases of Mpox found in the US. Because people were aware, took precautions, and got vaccinated, Mpox cases started to decrease. But there's still a possibility for an Mpox outbreak to come back. So, to keep you healthy and safe this summer, let's talk about it so you can be prepared and do the things you need to do, like get a vaccine to protect yourself from Mpox. So, what is Mpox? It's not a new disease. It's actually been around for a long time, but mostly in Africa, until last summer when we saw a global outbreak. Mpox, formerly known as monkeypox, is actually a virus that's related to smallpox. So you may be asking yourself, should you be worried about Mpox? Well, Mpox has been rare in the US and had mostly been related to international travel or infected animals. While infection rates are low in the general public, there was a global outbreak beginning last summer that mostly affected the LGBTQ community. Over 100 countries that never had Mpox before reported infections worldwide. Mpox is usually a mild disease with symptoms lasting from 2 to 4 weeks, but the rash of Mpox can happen in sensitive areas, which can be extremely painful, and some people might have scarring. So what are the signs and symptoms of Mpox? Well, Mpox often starts with symptoms that are similar to the flu, with fever, low energy, swollen lymph nodes, and body aches. Sometimes after the fever or on its own, a person can develop a rash or sores that can look similar to pimples or blisters. The rash or sores may be painful or cause discomfort and may be located in the genitals or anus or inside the mouth, but could also be on other areas like arms, legs, chest, or face.
Hello, I'm Dr. Winston Tillman, Medical Director of the HIV, STD, and Hepatitis Branch of Public Health Services at the County of San Diego Health and Human Services Agency. Let's talk about who can get Mpox. The bottom line is that anyone can get Mpox after having close physical contact with someone who has the infection, especially if coming into direct contact with rash, sores, and bodily fluids. However, the current risk to the general public is low. Though not exclusively, most recent cases include gay, bisexual, and other men who have sex with men, and trans women, as well as household contacts. There's a lot going on this summer, and you may wonder what your risk of getting Mpox is from attending crowded events. A person with Mpox can spread it to others from the time symptoms start until the rash has fully healed and a fresh layer of skin has formed. This can take several weeks. Mpox can spread to anyone through close skin-to-skin contact, including intimate physical contact, such as kissing, cuddling, or sexual activity, and contact from objects, fabrics, and other items that have been touched by an infectious rash, scabs, or body fluids. If you plan to attend an event, consider how much close personal skin-to-skin contact is likely to occur there. There are a number of ways to prevent the spread of Mpox. First, know the signs and symptoms, how the virus is spread, what to do if you feel ill, and what the risk is in your area or community. Next, talk to your sexual partner or partners about any recent illness or symptoms, possible exposures to Mpox, and new or unexplained sores or rashes. Also, limit close contact with people who have symptoms like sores or rashes and people who were recently exposed. Avoid touching rashes or scabs and contact with objects or materials that someone with Mpox has used. Practice good personal hygiene and wash your hands with soap and water. And last but certainly not least, get vaccinated if you are at risk for Mpox. So what is the Mpox vaccine? The Jynneos vaccine is approved by the U.S. Food and Drug Administration to prevent both Mpox and smallpox. Vaccination helps protect against Mpox when given before or shortly after an exposure.
Hi, I'm Dr. Carlton Thomas. I go by Dr. Carlton on social media. I'm based here in San Diego and I do sexual health and wellness. Do I need to get the Mpox vaccine? The Centers for Disease Control and Prevention and the California Department of Health recommend vaccination for anyone who's been exposed to an Mpox infection or who may be at risk for Mpox infection. Anyone who has been exposed or requests a vaccine does not have to report specific risk factors. The CDC recommends vaccination if you've been exposed to an Mpox infection, or if you're a gay or bisexual man or other man who has sex with men, or a transgender individual who has sex with men. Where can I get an Mpox vaccine? Contact your local healthcare provider. Visit myturn.ca.gov to schedule a free appointment, or visit www.sandiegocounty.gov/Mpox to find out about county coordinated sites and events. How do I get more information? Text COSD MPOX to 468-311 or visit www.sandiegocounty.gov/Mpox.